Hey everyone, and welcome. Today we're going to talk about something most of us have dealt with, or probably will at some point, the good old dental filling. Yeah, they're incredibly common, but do you know what's actually happening when you're in that chair? Let's break it all down.
You know that feeling, right? It usually starts small, that little twinge, a weird sensitivity when you drink something cold, or maybe just a dull ache that comes and goes. That's not random. That's your body trying to send you a signal. But what is it saying? And how seriously should you take it?
Okay, so you can think of these signs as your own personal, built-in alarm system. Your teeth are surprisingly good at telling you when something's not right. The real trick is learning their language so you can stop a little problem from turning into a big one.
So what exactly should you be on the lookout for? Well, a big one is a toothache that just hangs around and won't quit. Or maybe you've looked in the mirror and actually seen a dark spot or a tiny hole. And then there's that sharp, unmistakable zing of pain when you bite down, or when you have some ice cream or a hot cup of coffee. If any of this is sounding familiar, your tooth is definitely waving a red flag.
So, your tooth is waving that red flag. What do you do? Well, the great news is the answer is usually a really elegant and effective procedure, the tooth filling. This is pretty much the hero of our story today. So a filling does two really critical jobs. First, your dentist clears out the decay, which stops the cavity in its tracks. Then, they fill that little space back in. This does two things. It brings your tooth back to its original shape and strength, and it seals it off, creating a shield to prevent any more damage. So it's both a repair job and a security system all in one. Now, here's where it gets interesting. It's not a one-size-fits-all deal anymore. Back in the day, you didn't get much of a say, but now you've actually got options. And knowing what those are is going to help you and your dentist pick the absolute best one for you.
You can really see the pros and cons here. You've got composite, which is super popular because it matches your tooth color. It just blends right in, but it's a little less durable. Then you've got amalgam, that classic silver filling. I mean, this stuff is a workhorse. It's really strong, very affordable, but it looks like silver. Then there's ceramic. This one's kind of the best of both worlds. It's strong and tooth-colored, but it does come with a higher price tag. For pure, long-lasting strength, you have gold. It's the most expensive, but it's incredibly durable. And finally, glass ionomer, which is pretty cool because it actually releases fluoride to help protect the tooth from future decay. A really smart choice for kids. And when we talk about durability, what does that actually mean in terms of years? Well, that composite filling could last you a solid 5 to 10 years. That amalgam, you could get 10, even 15 years out of it. But gold is just in its own category. We're talking 20 years, maybe even longer. Really puts the whole long-term investment thing into perspective, doesn't it?
All right, let's talk about the part that can make some of us a little nervous. But I promise you, once you know exactly what's going on, it becomes way less intimidating. So let's just walk through the whole thing step by step.
It's really a very controlled 4-step process. First things first, your dentist confirms everything, maybe with an x-ray, and then they completely numb the area. And this is key. You won't feel any pain. Step 2, they carefully remove the decay. Step 3 is the main event. They place the filling material, shape it so it's a perfect fit, and then harden it. And for the final touch, they give it a quick polish and check your bite to make sure it all feels perfectly natural. And that's it. You're done.
So you made it through the procedure, you're out of the chair, and you're good to go. So what happens now? Well, taking care of your new filling is just as crucial as the procedure itself if you want it to last. Let's just quickly look at the scoreboard here. The benefits are huge, right? You can chew normally again, you've stopped decay dead in its tracks, and it's a fast, simple procedure. The risks? They're pretty rare and totally manageable. You might have a little sensitivity for a day or so, and yeah, over many years, a filling can wear down. The biggest risk, honestly, is new decay getting started around the edges, and that's something you can prevent with good care.
Which brings us to taking care of it. And the best part is, it's incredibly simple. It's basically the same advice he should be following anyway. Just keep brushing and flossing every day, try not to bite down on super hard things like ice cubes, and of course, keep up with your regular dental checkups so they can keep an eye on things.
So we've covered the what, the why, and the how of fillings. But I want to finish with what might be the most important point of this entire explainer, the actual cost of doing nothing.
Remember, a simple filling might cost a few $100s, but here's the thing about decay. It doesn't just hit pause. If you ignore it, it just keeps digging deeper. And that small problem turns into a much bigger one that needs a more complex and way more expensive solution. That little cavity can turn into something that needs a crown, or like you see here, a serious restoration that can cost over $1,000.
And it's not even just about the money. This quote says it all.
That decay keeps going until it can reach the nerve of the tooth. And that can lead to a really painful infection, a much more involved procedure like a root canal, or even losing the tooth completely. Waiting is just never a good strategy.
So really, it all comes back to that little twinge in your tooth. It's not just an annoyance, it's a heads up. It's an opportunity to solve a small problem with a simple solution today, before it becomes a huge, painful, and expensive problem tomorrow. A filling isn't just about fixing a tooth, it's an investment in your future health. So the next time your tooth tries to tell you something, the real question is, are you ready to listen?